Alright, so what we're going to do is talk about the proper structure of the cervical spine or the neck. So we're looking at an x-ray here and we see this is the jaw, this is the back of the head, these are the bones that make up the spine, and these dark spaces, these are the discs in between the bones. What I want you to notice, now there are some problems in this cervical spine, but we're looking at this curvature here. What I want you to notice is this forward curve. Now that is the normal structure of the cervical spine. Let me zoom in a little bit. You can see how that curves forward. And that's what we want to see in the cervical spine. What we find is when an individual is in a car accident and they receive a whiplash, the accident happens so fast that the muscles cannot help contract fast enough to help support the spine, so the ligaments are left to hold everything in place by themselves and they get damaged. And then what happens is after they're damaged, then the muscles contract and that causes an alteration in that curve of the spine. And this is what we get. So what we see here is this individual, rather than having that nice forward curve, they have kind of an S-shaped curve. So it's curves back in the lower part of the cervical spine and forward in the upper part. And that's because of damage to the ligaments. And the ligaments go from bone to bone along here in the front, and then bone to bone along here in the back. And they also have joint capsules. This is the articular pillars or facet joints in the cervical spine. And around each of these is a capsule of connective tissue, tight, strong connective tissue. And so this is a fluid-filled articulation or joint here with hyaline cartilage lining the joint surfaces, so they glide together nicely. And what happens is in a car accident, that joint can become damaged, that joint capsule can become damaged. And not a complete tear. There's no loss of gross integrity of those ligaments or that cartilage. However, there are micro tears that occur, and those micro tears alter the structure of that ligament and thereby allow for excess motion in these joints. Now that happens before the muscles contract, and then by the time the muscles contract, because of that loss of strength in those ligaments, we get an alteration of this cervical curve. Now that causes pain and discomfort, but more importantly, the pain and discomfort will go away if they do nothing. If they just take pain pills, muscle relaxants, pain pills, muscle relaxants, anti-inflammatories, over time the inflammation will subside and scarring will occur and the pain will go away. What will remain is this altered structure. And with altered structure comes altered biomechanics and altered motion, and with that comes rapid degeneration. So it's important to get checked following an auto accident, even if you don't have any symptoms. I've seen people come in with no symptoms and have this type of structure. So it's important to get checked, even if you don't have any symptoms, to make sure that you don't have soft tissue injuries leading to this type of malalignment, which would lead to rapid degeneration.